So can a man increase in size down there naturally?
Absolutely. Uh, One of the things that we've been doing for years is platelet-rich plasma. And platelet-rich plasma is where we take the body's own platelets, we take the blood, we process it, and we put this platelet-rich plasma back into the penis. Studies have shown that there can be some increase in penile size. Now, to be to get a more significant increase in size, we will use dermal filler, the type of hyaluronic acid fillers that we've been using in the face for decades. These fillers are safe. We place them in an area of the penis where it doesn't migrate. It's very natural feeling, and men can demonstrably increase the size of their girth. So that one doesn't do anything with length, but it's going to do a lot with girth. Neuromodulators like Botox and Dysport we can place into the penis. That will relax some of the retractile muscles, and the penis will then, in a flaccid state, be wider and oftentimes longer. It also will have better erections because increased blood flow. So does the prize shot with that. So those are some ways that we are able to help men increase their size. There are tissues that retract in the penis and the scrotum, and the neuromodulator will relax those and allow it to expand.
Great, great. Now, how do you get a reference point for the amount of increase that you can achieve?
Well, it needs to be done gradually, and done gradually, you can really the sky's the limit. But if too much filler is placed too quickly, too much pressure can be placed on the skin and decrease the blood flow. So we're very careful about that. Being a Duke-trained urologist, that part of the anatomy on a human body is very familiar, and yeah.
Great, great. Have you had any men come in with any wild requests in terms of size or?
Every man has a wild request when it comes to size.
Silly question.
Yeah, yeah. And I do have to tell them we can get there gradually, though.
Yeah. And when you say gradually, how many visits typically or
It
length of
depends
time?
on each individual.
Okay.
This is where it's one of those where men who are not so well endowed as far as length goes get more of an impact per syringe of the dermal filler than the men who are more endowed.
Ah, makes
Yeah.
sense. Makes sense. Perfect. So, what is your approach as a Duke urologist for addressing erectile dysfunction?
Well, first of all, when we were in our 20s, most of the people that might be looking at this video, well, Viagra and Cialis hadn't been invented, but most guys in their 20s can be very dependable multiple times a day or night. All right. So when they get to be 50 or 60, they're not Viagra or Cialis deficient. They didn't need it when they were at their prime. What they are is testosterone deficient. So the first thing that every one of these guys that's taken Viagra and Cialis need to do is get on proper testosterone optimization. And then there's the way they take it, which, when we have patients here, we tell them exactly how to take their Viagra or their Cialis because you've got to do it in a special way for it to be effective. Yeah.
Right. I have heard of people doing, injections for erections. Do you like those over a pill or?
Well, there's a injectable method called Trimix, which is a recipe of different vasodilators. It works, but it's very inconvenient. And yes, that is a needle anytime you want to have sex in your private part, and that is not something many men are
Right.
happy about. And so, it's so much better to do this naturally, and that's what PRP does. If we can use their body's own growth factors from the platelet-rich plasma, that's the most natural way to help with their erections.
And I know a lot of men travel to see you for the Restore More, in terms of increasing that girth.
Mm-hmm.
When we're doing combination treatments, what are your favorite combination treatments, especially for the men in that area?
The ultimate combination is going to be testosterone management with one of the different modes that we have for that, and then doing a platelet-rich plasma propus shot procedure with platelet-rich plasma, and also placing some neuromodulator like Botox in with it. And then while they're still numbed up, we can go ahead and put the dermal filler for the Restore More to increase their girth instantly. That combination is, I guess, something we've been doing, 5 to 10 times a week here.